Here are some tips that I've learned from being a medical malpractice attorney. If you or a loved one have symptoms of a stroke, go to the hospital. What are those symptoms? There's a headache, there's confusion, there's dizziness, there's facial droop. These are stroke-like symptoms, and if you have them or your loved one has them, go directly to the hospital. There is a drug that can be given that can stop the stroke from happening or minimize the effects of the stroke. These drugs have to be administered within 3 to 4 hours of the onset of symptoms, so you have to go to the hospital. So many of the cases that I get regarding stroke involve people who have gotten to the hospital too late. And if it's a case, if the doctor sent them home and then they had to come back and that's why it's too late. But if you know you're having these symptoms, go to the hospital. And here is a bonus tip on this one. If you really do have a horrible headache and it's the worst headache of your life, you go to the hospital and say that. Use those words. Those are the buzzwords that emergency room physicians are trained to hear and to know. When you hear those symptoms, get the stroke team in and work the patient up for a potential stroke. So if you do have the worst headache of your life, use those words and you'll get the treatment that you need.